Hi everyone, Gary White here again. Sorry that I could not join you all for the Saturday session. So here's my second attempt at leading a discussion on the protection of human subjects in research. This is case study number 3 for the choices that we had. Keep in mind that for the protection of participants, ethically responsible research requires adequate protection in the research we conduct, as we all know. Most everyone's familiar with abuses in the name of research that have put subjects' lives at risks. You remember the Nazi medical experiments and the Tuskegee syphilis study and other often egregious biomedical experiments. These studies and others have prompted governments to put in place regulations that guide research with human subjects. So this particular case, you're teaching an MSW research course in which students need to propose and conduct a research project. Tanisha, one of your students, is interested in the area of substance abuse and wants to do her project on that topic. She's confided to you that her interests stem from the fact that her sister has experienced substance abuse problems for many years and has been in and out of treatment. So she's currently doing her MSW internship in a mental health clinic where many of the participants have substance abuse issues, and she proposes to do a study that looks at the relationship between various patient characteristics and whether or not the patient completed the clinic's substance abuse treatment program. She'll use information in patient records to conduct her study. So we're going to ask some basic questions. What advice would you give her about her study, and what ethical issues should she address? Keeping in mind that the current system of human subjects protections has primary components consisting of the ethical principles of the Belmont Report and also the Code of Federal Regulations, or CFR, as it's commonly called. The Belmont Report, the report's named for the location in which the document was originally drafted in 1979 by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. This report, as you remember, established 3 fundamental ethical principles that commission members should use to guide all research with human subjects, and that's respect for persons, beneficence, and also justice. The CFR, on the other hand, the Belmont principles underlie the code of federal regulations related to protection of human subjects in research. This is sometimes just referred to as the common rule, and it establishes the rule for ethical conduct of research and mandates that organizations that receive federal research funding establish an institutional review board, an IRB, to implement and monitor the regulations. These regulations also require that those who conduct research with human subjects receive training. So the IRB, as we all know, it's the local organizational body that is charged with reviewing research to determine whether it meets all of those ethical standards that were established by the Belmont principles and set out in the federal regulations. It requires all that you see listed here. Following these rules helps ensure the ethical treatment of subjects and the protection of those subjects in our research. So don't forget to share your thoughts on this particular case. Here's some references, and here are the questions that we'd like to consider. What advice then would you give Tanisha about proceeding with this study and why? And what ethical issues should she address? If you have the time, I'd like to hear your thoughts and comments about this and how it relates to the ethical treatment of subjects in research. So don't hesitate to share your thoughts in the chat box here. I'm looking forward to it. So thanks everyone for listening, and I hope to hear your thoughts.